There's a powerful new class of cancer therapies called DDR inhibitors. They work by preventing cancer cells from repairing their own damaged DNA, ultimately killing the cell. They have the potential to provide patients with incredible new options. But there's a critical gap. In order for them to work, we must be able to detect DNA damage with high sensitivity and use evidence-based patient selection. How do we know which patient will respond? That's why we're developing dSTRIDE-HR. It's the first ever functional homologous recombination test, or HR test, for real-time measurement of HR repair pathway activity in tumors. To put it simply, the test reveals a tumor's ability to repair damaged DNA. This will help researchers understand the impact of treatment with DDR inhibitors like ATR inhibitors and PARP inhibitors. With these insights, clinicians will be empowered to make more informed care decisions, leading to better outcomes for patients. Get in touch to explore what's possible with dSTRIDE-HR.